Hey everyone, and welcome back to the channel. Today, we're going to talk about something that affects billions of people worldwide, myopia, or what most of us just call nearsightedness. Have you ever wondered why you can see your phone screen perfectly, but the street sign across the road looks like a blurry mess? Well, you're in the right place, because we're about to demystify myopia. So, what exactly is happening inside our eyes when we're nearsighted? Imagine your eye is like a camera. It has a lens at the front and a sensor at the back, which is your retina. In a perfect eye, light comes in, the lens focuses it precisely onto the retina, and you get a sharp, clear image. It's like a projector hitting the screen just right. But with myopia, things are a little different. For one of two main reasons, that light doesn't focus correctly. The first reason is that the eyeball itself might be a little too long from front to back. The second reason could be that the cornea, the clear front part of your eye, is too curved. Either way, the result is the same. The light focuses in front of the retina instead of directly on it. So, by the time the light image actually reaches your retina, it's already gone out of focus, making distant objects look blurry. Now, you might be asking, why does this happen? What causes myopia? It's a great question, and the answer is a mix of genetics and lifestyle. If your parents are nearsighted, you've got a higher chance of being nearsighted too. It's like inheriting your dad's nose or your mom's smile. You can inherit a predisposition for myopia. But genetics isn't the whole story. Our modern lifestyles play a huge role. Think about how much time we spend doing near work, staring at phones, tablets, computers, or even just reading a book up close. When we do this for hours on end, our eyes are constantly in a state of focus for close objects. Some research suggests that this prolonged close-up work can encourage the eyeball to grow longer, leading to or worsening myopia, especially in children and teenagers whose eyes are still developing. Another lifestyle factor is the amount of time we spend outdoors. Studies have consistently shown that kids who spend more time playing outside have a lower risk of developing myopia. Scientists believe that the bright natural light outdoors might help regulate the eye's growth in a healthy way. It's not about the physical activity itself, but about the light exposure and looking at things in the distance, which gives our eye muscles a much-needed break from constant close-up focusing. So how do we fix this blurry world? The most common solutions are glasses and contact lenses. These work by adding an external lens to help your eye bend the light correctly. They're essentially pre-focusing the light, so that when it enters your eye, your natural lens can direct it right onto the retina. Think of it as giving your eye a little helping hand to get the job done. For those looking for a more permanent solution, there are options like refractive surgery. The most famous one is LASIK. In this procedure, a surgeon uses a highly precise laser to reshape the cornea, correcting its curve. By changing the shape of the cornea, they can change how light bends as it enters the eye, allowing it to focus perfectly on the retina without the need for glasses or contacts. It's an incredible piece of medical technology, but it's a big decision and not suitable for everyone, so it's crucial to consult with an eye care professional. There are also newer treatments being explored, especially for children, aimed at slowing down the progression of myopia. These can include special types of contact lenses or eye drops. The goal here isn't to cure myopia, but to stop it from getting worse over time, which is really important for long-term eye health. So, there you have it, a deep dive into the world of myopia. It's not just about having blurry vision. It's about the shape of your eye and how it focuses light. While genetics plays a part, our daily habits, like screen time and outdoor time, have a significant impact. The good news is, whether you choose glasses, contacts, or surgery, there are fantastic ways to see the world clearly. If you found this video helpful, please give it a thumbs up and consider subscribing for more content about how our amazing bodies work. And don't forget to hit that notification bell. Thanks for watching, and we'll see you in the next one.